Many workers will be moving from big cities to countrysides across the SADC region during this holiday season. Workers are expected to cross different borders, especially to Zimbabwe, which is traditionally seeing a large number of people crossing there. Most individuals will require COVID-19 documentation to be able to travel from South Africa to their neighboring countries. Joining us now to unpack the challenges of working migrants during the holidays is Professor Jo Vearey, who's Associate Professor with the African Center for Migration and Society at Wits University. Prof, thanks very much for your time and welcome to the AM Report. It's an issue that doesn't typically receive as much attention as it should, especially at this time of the year. Take us through what these blind spots actually then mean for migrants who face these challenges year on year.
I think the key issue at the moment is that our nationwide and regional response to coronavirus has not adequately engaged with the movement of people either within their country of birth or across borders. And for a region and particularly a country that is associated with such high levels of movement in terms of searching for work and formalized migrant worker systems, this is quite concerning. And I think that as we come, this week closer and closer to Christmas, and then obviously with the new year as well, there are concerns about the ways in which domestic movement and movement across borders is potentially being left out of our current response.
Yeah, and what new threats does that pose to things like our fight against the pandemic, for instance? I imagine top of that list might be if we're not able to account for who's entering and leaving, it's really difficult to account for who might or might not have the virus.
I mean, if we're talking about movement across international borders, we need to remember that this is actually the smallest amount of movement that we see in the country. By far, the largest amount of movement is people moving within the country. So what's really key if we're talking about international borders is recognizing that at the moment, the ways in which our entry and exit systems in terms of COVID and in terms of disease surveillance are in place at land borders, which is where the majority of people cross, are potentially restrictive, and as a result it may lead to individuals moving in irregular means or across other parts of the border that aren't through formal land borders. This is simply because of the requirements needed for individuals to pass through those formal border crossings.
It does raise questions around the responsibilities that host countries should have to try easing the burden, so to speak. What ways can countries like South Africa do things differently to that end?
I think the key thing is making sure that we include issues around migration as a process in our responsiveness and in the ways in which we think about the ways that we're planning. Challenge at the moment is that when we talk about migration and mobility, people tend to only think about an individual. They think about an individual migrant, they think about an individual asylum seeker or a refugee, and they cannot think about migration as a process of connecting, a process that is linked to livelihood strategies across the continent. And one of the big things that the ways in which the continent has responded, and this is based on work we've done continentally, is the ways in which border closures have taken place is they've re-emphasized the importance of migration and mobility as an important livelihood strategy across the continent. And this is no different in our region. So we need to think about ways that we can ensure safe movement, safe travel, without putting in undue restrictions. And there are ways within disease control programming and under a global health security framework to ensure that this can be done effectively and safely.
Yeah, of course, in the backdrop, Professor Jo, is issues around how migrants are being interacted with socially and politically, right? So, for instance, as we deal with the global health crisis, there's been instances where there's been rhetoric aimed at migrants that appears to hold them responsible for our ailing public health systems, et cetera, et cetera. I mean, how do we navigate those salient issues unfolding in the backdrop as we try to address what sounds to me like systemic issues, really, affecting particularly migrants in the SADC region?
I mean, you've touched on a key issue. We have to recognize that some of the tensions that we're observing at the moment, which is manifesting in multiple ways, are not new, particularly when it comes to, for example, the South African public healthcare system. We know for over a decade, foreign nationals living, working in the country are often incorrectly blamed for failures in the provision of healthcare by the state, particularly in urban spaces and sometimes in border areas. And we have to recognize there's no evidence to support the idea that foreign nationals are in any way responsible for any of these challenges that are experienced. The numbers of foreign nationals are far smaller than people assume. Of course, when people are looking at issues around foreign nationals, they tend to focus on densely populated urban areas or border regions. But when we look nationally, we know that only about 4 or 5% of the country is estimated to be a foreign-born national. And within that, we need to recognize that many do also have access to private healthcare, but those that are reliant on the public healthcare system are facing the same challenges that South Africans who are reliant on the public healthcare system face, with additional burdens linked to their nationality and perhaps languages that are spoken.
Yeah, if the empirical evidence is so different from what we're seeing on the ground, so to speak, who do you think then is dropping the ball on the sustained rhetoric that we've been hearing, as you put it, for years now?
I mean, unfortunately, we see an increasingly kind of nationalistic rhetoric coming from our political leadership. We see increasingly that issues around immigration in particular, but also domestic movement, is used by local leaders, particularly in politically contested areas. And unfortunately, we do see this sometimes manifest in forms of organized violence, for example, around we've recently witnessed in Durban. And I think we have to be very, very careful in ensuring that we're holding those individuals accountable, because what we're seeing, and this is not unusual, it's happening globally, we are seeing that political rhetoric, that anti-foreigner sentiment is bleeding into the ways that we're developing programs and we're developing responses and policies. And we're seeing this also in the way that the responses to COVID have been developed, is that I think in the initial phases, I think it was inadvertent. I think there was some overlooking of the need to translate information into various languages, to reassure people in the country with different documentation status, that would not be taken into consideration when looking at testing, screening, contact tracing. We know that information wasn't put clearly forward to people, but there's really no excuse now for that information not to be being shared, and for a much more coherent and regional response. What we really need to see is that actually COVID potentially provides an opportunity for improving the ways in which we collectively are responding to a public health crisis, a global pandemic, particularly in the region where we are also connected across borders. We need to ensure that there is a cohesive response.
Such an important issue. Thank you so much for helping us highlight it and perhaps reflect on it much deeper than we would have until this point. Certainly appreciate your insights. Jo Vearey is the Associate Professor with the African Center for Migration and Society at Wits University. Appreciate your time indeed.